Welcome back to the Woven Well podcast. Our show is designed to give you practical, natural fertility resources that can help in your everyday lives. We talk about family planning, infertility treatment, medical professionals, reproductive health concerns, and more. One thing that comes up again and again is the importance of a supportive medical professional in your community. But what if there isn't one? What if you don't know of a medical professional who encourages fertility awareness methods or knows how to utilize them for your health? What if you have an OBGYN that you love, but they are clueless when it comes to these specific topics? I've invited Dr. Marguerite Duane to talk with us about these questions and help us learn how to encourage OBGYNs to incorporate fertility awareness methods into their practices. Dr. Duane, a board-certified family physician, is co-founder and executive director of Facts About Fertility, an organization dedicated to educating medical professionals and students about the scientific evidence supporting fertility awareness-based methods. Dr. Duane trained as a Creighton, FEM, and neo-fertility medical consultant and a Teen Star educator. She received her MD degree from the State University of New York at Stony Brook and completed her family medicine residency at Lancaster General Hospital in Pennsylvania. She received a Bachelor of Science with honors and a Master of Health Administration degree from Cornell. And in 2022, Dr. Duane completed a primary care research fellowship at the University of Utah, earning a Master of Science in Public Health. Dr. Duane, welcome to the show.
Thank you so much, Caitlin, for having me. I'm delighted to be here today.
I am really excited about what you have to share because I know this is a big issue for a lot of women. But I mentioned your role as co-founder and executive director at Facts About Fertility. Would you share with us what your organization does?
Sure. So, Facts About Fertility is an organization that I co founded in 2010 with another family physician, Dr. Bob Motley. And originally, we were called the Fertility Appreciation Collaborative to teach the science. And our name really talks about what we do. We want to educate the medical community, both physicians, nurse practitioners, midwives, pharmacists, students, residents, anybody in the healthcare professional community about the science underlying fertility awareness-based methods, female cycle tracking, and how this can be used by women to monitor their health and in conjunction with their medical professional to help them better identify, diagnose, treat, and manage a wide range of women's health conditions. Also, we want to educate the medical professional community about the effectiveness of these methods from a family planning perspective. And we like to highlight that fertility awareness-based methods are the only true forms of family planning because couples can use these methods both to postpone, space, or prevent a pregnancy, as well as to help achieve a pregnancy. So we believe that through education, we can help both the individual patients and the medical professional community develop a healthy appreciation for fertility. We want to collaborate with our medical colleagues from all disciplines, OBGYNs, family medicine, women's health and nurse practitioners, midwives, PAs, etc., to teach the science. That's our focus. Our goal is to share the facts about fertility. And in 2022, we became our own nonprofit because we've expanded our reach well beyond where Facts began in 2010, and are now educating students and healthcare professionals not only throughout the Northeast part of the United States, but all around the US and, in fact, all over the world.
That is so important and so fantastic. And I've been a big fan of your organization for a while because of what you do. And I think that this is something more and more women are interested in because they're looking at natural approaches to fertility and they find themselves asking, why don't more OBGYNs know about or value fertility awareness methods? There are so many benefits to their use, but women are often given an eye roll or, deer in the headlights look from their medical professionals. So why is that?
You know, that's absolutely true. And the reality is that we as medical professionals simply do not learn this information. This is not a part of the standard curriculum, whether it's in medical schools or nursing schools. It's simply not covered. And so I encourage your listeners to give grace to the medical professionals that are providing your care because they simply may not know this. For me personally, I had never learned anything about any of these methods. I'd never heard the term fertility awareness or natural family planning, or learned about healthy cervical mucus, or knew what basal body temperature was until I was actually in my first year of my family medicine residency at Lancaster General Hospital. I had graduated from medical school. I'd already completed a master's in health administration and had worked for a few years. So I was a little bit older even, but had never learned about these methods. And the only reason I learned about it when I was a resident is I happened to have a senior resident who was trained in the Creighton model. And when we were on OB call one night, and I was doing what any good intern does on OB call, I was getting all of my postpartum patients ready for discharge by writing their birth control prescriptions because that's what we were advised to do. My senior resident said, Dean, did you know there's some forms of family planning that women can use that have no medical side effects? And I said, what are you talking about? Like every form of family planning, whether it's IUDs or birth control pills or condoms even, they all have side effects. And she said, no, women can actually learn to chart the signs of their fertility, whether it's cervical mucus or basal body temperature, to identify when they're fertile and when they're not. And I was like, what are you talking about? I had never heard this. I thought to myself, why didn't I learn about this when I was in medical school, right? This seems like basic reproductive physiology. And then I thought, why didn't I learn about this in college when I went to the student health center with painful periods and the only option that was offered to me was the pill? And I was like, but I don't need birth control. They're like, but this is the best treatment. I dealt with side effects myself and realized this isn't actually the best treatment. And I thought, why didn't I learn about this when I was a teenager going through puberty? And the reality is this information, up until very recently, has not been made widely available. And so that was in the year 2000 when I was a resident. A few years later, I pursued training in the various methods. And then in 2010, when I was on faculty at Georgetown University, I had the opportunity to teach a small group class on any topic related to healthcare. And I thought, why not teach a small group of medical students about natural methods of family planning and female cycle charting? And so I did. And the feedback from the students was so overwhelmingly positive. They're like, why didn't I learn about this before? Why isn't this a part of our
Yes.
basic reproductive physiology curriculum? This is something every medical student should learn. And I thought, they're right. This is something every medical student should learn. But the reality is we don't. That is what inspired us to form FACS. What's interesting is when we started FACS in 2010, there was a study published that very same year that looked at OBGYNs and family physicians, the two physician specialties that provide the majority of women's health care and family planning services. And they did a study of these specialties. And what they found was that practicing OBGYNs and family physicians, only 3 to 6% were familiar or knowledgeable about modern evidence-based natural methods or fertility awareness-based methods of family planning. So again, it's something we simply don't learn about. So what started in 2010 with an elective at Georgetown has grown into FACS and has led to us reaching medical students from over 100 different medical schools all over the world. But it's still the only elective of its kind. It's still the only course of its kind. Now, we're bringing it into nursing schools and into PA schools. But again, I encourage your listeners, give your clinicians, your medical professionals grace because they simply may not know about it. And if they don't, but they're interested in learning more, refer them to our factsaboutfertility.org website because this is our goal to help educate about all of the natural evidence-based methods and their role in women's health and family planning.
I love this. When you were teaching that first group, or even over the years, as you've continued to teach hundreds and thousands of medical professionals, what have you found to be the most impactful in changing their mind about this?
Yeah. It's very simple. Sharing the science. We start out with this is normal reproductive physiology. This is how the female cycle works, and this is how the male reproductive system works. We teach them the basic science. We teach them how, throughout the course of a woman's cycle, the cyclical changes, hormonal changes she experiences are manifest in external observations, signs that a woman can learn to track. The rising estradiol leading up to ovulation will result in the production of fertile type cervical mucus that a woman can observe. When she gets closer to ovulation, it'll trigger an LH surge. Sometimes that can be detected, oftentimes can be detected with an LH monitor by using urinary hormone test strips. Once a woman ovulates and her progesterone levels rise, this will cause a change in her cervical mucus, which she can then observe. And it can also result in a rise in her basal body temperature. So we teach the students that a woman's external observations of her cervical mucus, her basal body temperature, and her urinary hormones, these daily external observations create a daily diary that reflect the internal hormonal changes. We oftentimes will invite or encourage students to learn to chart themselves. And when they see what's happening in their own bodies, it's astounding to them. And they have the reaction that many women have, like, how have I never noticed this? I never
Yeah.
knew that discharge was normal. I always thought it was something that was wrong, perhaps a disease or perhaps poor hygiene. And I didn't understand this. So the
Yeah.
students are really blown away by the science. So we go back to the basics, we teach them the signs that women can learn to observe. Then we actually have a webinar for patients, for the general population, called The Facts About Fertility Explained, where we explain the different signs that women can learn to observe. And then we discuss the different methods that women can learn to chart with. And again, how this daily diary really serves as a health diary and really serves as a vital sign. And in fact, what's important to know, what I explained to my medical colleagues, that the American College of Obstetricians and Gynecologists and the American Academy of Pediatrics both recognize the female cycle, the menstrual cycle, as a fifth vital sign. And so to really be able to utilize it as a vital sign, we need women to learn to chart their cycles. And they don't need to wait until they're, using it for family planning purposes or struggling with infertility. We mentioned I'm a Teen Star educator. I'm a big believer in teaching adolescent girls to chart their cycle to better understand and monitor their health. So what we find most impactful is sharing the science. The facts about fertility explained really opens their eyes to how powerful the tool of tracking the female cycle really can be. And then the students say, why aren't we learning this in our reproductive physiology and pathophysiology courses? Like, all they're really often taught is that if a woman comes to them with irregular cycles, abnormal bleeding, painful cycles, like I had presented to my student health center, the recommended treatment, of course, is hormonal birth control, synthetic hormones, maybe an IUD. What we help them to understand is that that actually doesn't treat any of those underlying conditions. And it doesn't help get at the root cause of, why is she having irregular cycles? Perhaps she's having irregular cycles because she has polycystic ovarian syndrome. And that would be manifested in her chart by lots of days of mucus. But maybe she has irregular cycles because she's under a lot of stress or not eating enough or over-exercising. This may result in very dry cycles. Again, looking at the chart is going to help tell us, and then the treatment plans are going to be different. So when we teach the students that charting the female cycle can help you get at a more accurate diagnosis and a more targeted treatment, and not simply suppress the symptoms, which is what synthetic hormones do, they're blown away. And they're like, we need to do this. Women deserve this. And this is what we want them to understand. Women deserve better. They deserve doctors that are willing to make a diagnosis, learn how to read the female cycle chart to help them make that diagnosis, and develop a treatment plan that actually gets at the root cause. And that's what fertility awareness-based methods and a restorative approach to reproductive health care really offers women and men and adolescents. And so that's our goal at Facts.
I know that I've got listeners right now who are itching to be a part of this because I know that patients, when they're in the room with the doctor, and when more and more patients are feeling excited about something, I think that they have the potential to create a lot of positive change.
Yeah.
So what can we as listeners, as patients, as women, what can we be doing for those who are working with those professionals directly, even what can we be doing to encourage this change and encourage our medical professionals to invest more in fertility awareness methods?
Yeah. So again, I would start by giving grace to your medical professionals if they look at you and they're like, what is this? They don't have a clue. Perhaps you bring your chart to your physician and they're like, at this, this means nothing to me. I don't know how to read this. So like, I
Yes.
understand. Like, my understanding is this is not routinely taught in medical schools. FACS actually did a survey a few years back where we surveyed women about their experiences talking with their clinicians about their use of fertility awareness-based methods. And many of them said their doctors didn't know. Some were, you know, ignorant but open. Some were obnoxious and mocking. A third of patients that they've had doctors laugh at them,
Yeah.
midwives make fun of them for like, well, you can't do that. That's the rhythm method, honey. And it's like, no, no. The rhythm method was developed a century ago, right? And at
Yes.
the time in the 1930s, it was one of the best methods. It was based on the best science, but science has evolved. And, acknowledge, like, I recognize it's hard to keep up with all the latest advances in medicine, but what I'm doing now, charting with a modern fertility awareness based method, is based on the science. And there are organizations that teach this rooted in the science. Again, I encourage your listeners to use the factsaboutfertility.org website as a resource. We have a fantastic article on there that's called Fertility Awareness Based Methods for Women's Health and Family Planning. This is a peer-reviewed article in a medical journal that is available for free for download on our website. If you click on Learn More and Research, you can click on the link and I'll provide it to you so you can provide it to your listeners. This is a summary of the evidence supporting the use of these methods, not only from a family planning perspective, both from a preventing pregnancy perspective and in helping couples to achieve pregnancy, but also all of the women's health applications. So saying, I realize this may not be something you're familiar with. Here's an article that goes into the science supporting the use of these methods. Some medical professionals, like I said, may refer to this as the rhythm method. Some people may assume that women are using it from faith-based purposes, and many people choose to use these methods because it aligns with their faith. Some people choose to use these methods because they're concerned about the environment and all the synthetic hormones that are in the environment. Regardless of why you choose to use a natural method, these are rooted in science. And so I would encourage you to encourage your clinician to learn more. At FACS, not only do we have research articles and we've got blogs that summarize the latest research, but we have online continuing medical education courses. We have introductory webinars that are available for both medical professionals and patients alike. I mentioned the Facts About Fertility Explained. We have a medical presentation on fertility awareness-based methods for family planning. We also have one called The Female Cycle as the Fifth Vital Sign, again, highlighting the medical benefits of using these methods. And then we've got full online continuing medical education courses. So we encourage you to connect your medical professional, your OBGYN, your midwife to FACS and our resources. We welcome them to be a part of our community. We do a monthly Community Connects event if they're interested just in learning more. And we also recognize this is hard because the way we're trained in medicine, again, is that female fertility is a problem to be solved,
Mm.
process to be suppressed, right? And the way we're trained is to use synthetic hormones or conventional forms of birth control, whether they're long-acting reversible devices such as IUDs or hormonal birth control pills to quote unquote treat, or give women a regular withdrawal bleed. These actually don't treat them, but this is how your clinicians primarily have been trained. And if you're struggling with infertility, women are often automatically referred for IVF. Again, IVF seeks to bypass the underlying cause and not treat the root problem. So we encourage you, if your doctors are not open to learning more about restorative reproductive medicine, we encourage you to learn and work with restorative reproductive physicians and medical professionals. Again, on our FACS website, we offer a resource called the Physician Clinician Educator Directory. If you're a listener and you are trained in a natural method, perhaps you're a teacher or you're a clinician, we invite you to list yourself on the directory, but it's also a directory for people to find physicians that are trained. There are other services that offer fertility awareness-based trained physicians. There's the NAPRO Technology website, there's the FEM website, there's My Catholic Doctor. These all offer links to doctors that are trained in many of these natural methods. But at FACS, our focus is on reaching all medical professionals with the science supporting all of the evidence-based methods. So if you're looking for a one-stop shopping, one place to send medical professionals, we certainly invite you to refer them to the factsaboutfertility.org website. And at the very least, share some of the latest research that we're publishing to help them understand the science and how this really is a fifth vital sign that can truly make a difference in the lives of women and men.
Dr. Duane, thank you so much for sharing all of your knowledge and resources. I know it's going to be really make a difference for listeners out there who want to make a change.
We hope so. And again, although our target audience is the medical professional community, we certainly invite those who are not medical professionals or not educators who want to learn more to certainly visit our website and, stay connected. And if you need help finding a medical professional, please reach out to us. We want women to receive the best care. And part of why we started FACS was the fact that when we started some of our early research studies, we found that there were less than 1,000 medical professionals trained in these methods. Now, in the last 5 years, we've trained nearly 1,000 medical students in all of the methods. So this is our goal, that there will be a fertility awareness-based method or restorative reproductive medical professional in your community. Until then, if you need help in finding one, send them our way. If you yourself want to learn more, take advantage of our webinars. Refer your medical professionals to our courses. We're doing a virtual conference on Saturday, October 19th, that will touch on each of the restorative reproductive methods like Creighton and FEM, Neo-Fertility, Marquette. So it's a great opportunity. We even are going to talk about integrative medicine and a functional approach to healthcare. So it's a great opportunity to refer physicians or clinicians that might be skeptical about one method to have exposure and learn about all of the methods. And so we certainly invite your listeners to learn more, reach out, help us help you educate the medical professionals that you're working with to understand the beauty of tracking the female cycle so they may come to appreciate fertility and hopefully collaborate with FACS to teach the science to even more medical professionals and students in the future.
Absolutely. Thanks so much for being here.
You're welcome. Thank you.
Listeners, I really believe that our actions today can have a positive impact, not only for ourselves, but also for future generations, our daughters, our granddaughters. And we can do our part in gaining knowledge about our cycles, incorporating it into our reproductive healthcare decisions, and passing this information along to others. So one aspect of that is by learning about your own fertility and learning a fertility awareness method yourself. Behind the scenes here at Woven Natural Fertility Care, we teach the Creighton method, and we'd love to invite you to learn more about it yourself. Check out the link in the show notes for our upcoming introductory sessions where you can learn more about what it is, how it works, and what it tells you about your own reproductive health. Want to give us feedback or ask a question about today's episode? You can actually send us a text message. Look in the show notes for the link to do that. As always, thanks so much for listening as we continue to explore together what it means to be woven well.